So I think I can start now. Hello, everyone. I hope you are enjoying AstroCamp. I hope you are enjoying Portugal and especially Paredes de Coura. As Professor said, my name is Beatriz Domingues, and today I'm here to talk about how AI is changing healthcare. But first things first, just to talk a bit about myself. As Professor said, I am from Paredes de Coura. I was a student in the first AstroCamp in 2012. It was a very long time ago. Um, and a bit about my academic background. After AstroCamp, I went to college and I studied biochemistry. And I did a master in molecular biology, and after that, I enrolled in a PhD focused on improving clinical devices. So my goal was to always to use my skills to improve healthcare. In first years in my research, I focused on cancer therapies to improve treatments to patients. I focused on therapies that patients develop resistance and how to improve the treatments. And then in my during my PhD, I focused on improving devices, materials, things that were used in the daily routine of a hospital, and I focused on urinary devices, how to improve them in order to patients to feel less pain and especially had less bacterial infections. So, as I said, my goal was to always to use my skills and turn them into innovation that could help patients and could help people all around the world. Later, I will tell you how I end up as a clinical researcher. That is my current job in a Portuguese company. So, just to guide you, I will introduce this team. I will talk a bit about AI, and I will talk how AI can be used in healthcare. Just to um, so your expectations are in accordance with the reality. I will talk more about health than AI because it's my expertise. But I will talk a bit about AI and how this Portuguese company is using AI in healthcare, the benefits and also the challenges and the future of AI in this area. So, but instead of jumping right away into sci-fi scenarios, I want you to think about real situations that you might be seen in your family, in your community, or even in your life. I'm sure some of you know someone that feels pain or it injured the leg, the knee, or the arm. It's very common. And imagine uh, someone hurts their back playing some sports, and instead of going into a clinic twice a week, they have an app that gives them exercises and check their posture and can correct the exercise through the camera and sends them feedback as a physiotherapist therapist will do. All of this without leaving the house because they can do the exercises at home. Especially when someone hurts the knee, imagine having to drive to the clinic. Sometimes that is impossible due to the injury. So probably they will have to go by public transportation, but then it will be more 1 or 2 hours out of their home, and that can be very uncomfortable for people with pain. So is in these cases that technology can help healthcare and can help patients access to these type of services, and it's here that AI can help. So, in in very simple terms, as I said, I'm a, a biologist, a biochemistry, not engineering, informatic engineering. But AI is different from traditional programming because in traditional programming, you give the rules and computer follows them. And in AI, you can give examples and the computer learns from the examples. It's like you can teach a friend how to play chess by showing them the rule book, or you can teach them by showing them several games, different players, and he will eventually learn how to play the game. That's how to put it in simple terms. So, how can this help in healthcare? In many ways, to be honest, healthcare can be a partner to help improve and enhance some of the features that are used in healthcare and can help clinicians to be faster, to be more accurate, and can give them like superpowers, super analytic powers. In terms of diagnosis, I think it's really simple to understand how AI can help. Imagine a good clinician. A good clinician is someone that maybe has a lot of experience, saw a lot of different patients, and can, for instance, look at a X-ray exam, imaging exam, and see partners, can see trends, and can detect differences and things that are similar with other patients that he saw before, and can give a plausible diagnosis. So AI can do that. AI can look at millions, hundreds of millions of images at the same time, can compare the imaging of that patient, and can say probably this patient with this imaging and with this type of historic diagnosis, like the age, the weight, the other health parameters, probably this patient has this diagnosis. And he can do that by comparing with hundreds of millions of other images. He knows the other images, he knows what to look for, and he knows what the image are associated with. So it can be a really superpower to know this comparison in seconds. But of course, always a clinician has to deliver the final diagnosis. But it's a way to compare with millions in a second. It's really a superpower. In surgery, it's also very interesting to how this can be used, especially in robotic surgeries that are every day more common. And in these cases, AI can help in robot assisted operations in terms of very precise movements that are required for the operation, very delicate operations. But one interesting thing is that AI can also improve the machine or can tell how to improve the machine. Imagine a robotic arm that is used to perform a certain surgery. AI can give feedback and how which point to improve the movements that are needed for that operation. And that kind of feedback is really valid because it can look at several points in the same time and can estimate which point will be more valid to modify. In terms of drug discovery, it's also an area that it can benefit a lot from AI. because AI can predict how molecules will interact with each other, can predict how molecules will interact in specific conditions, temperatures, environments. So, for in a scenario with hundreds of possibilities of molecules that can be used for a certain treatment, for instance, AI can narrow down the amount of molecules to be studied, saying like of these 100 molecules, you can study these five that have the most potential for to have a therapeutic effect. And that is very important in the area that in the research area that everything it's very expensive, and to know the molecules that have the most potential can short down the time to discover a new therapy by significantly. So it's a very important field that AI can really help. And so this led us to faster and more accurate diagnosis, personalized treatments, and also lower costs and better access to care. And in simple terms, so AI can be seen in healthcare as a combination with speed, accuracy, and personalization that are three very critical points in healthcare. And how all of this is seen in a company, in a Portuguese company. This company is called Sword Health and uses AI to deliver healthcare services. This Sword Health started from a personal experience. In the photo here is V, that it is the founder, is the CEO. And when V was young, his brother was hit by a car and needed physical therapy. And unfortunately, they lived in a very small Portuguese town, like Paredes de Coura, a very small town. And his parents have to drive 100 kilometers for treatment, to arrive to the hospital for treatment during several months. And it was very exhausting and it was very difficult at the time. And the idea was then to use technology to make physical therapy accessible anywhere to anyone. And so that was how the idea was born. But V was a kid, and so we had to wait a few years to see that happen. But for contextualizing, so physical pain is really a problem that affects a lot of people in the world. I'm almost sure that some of you know people that suffer from pain, from back pain, leg, knees, shoulder, some type of pain. Uh, I'm sure some familiar in your communities. You may know someone that suffers from this. It's a really common condition, and we even spend more in physical pain than in cancer in diabetes combined. That is because it's so many people that suffer from this condition that the costs are enormous. So Sword Health started 10 years ago. This Portuguese company started 10 years ago. And the first product was Thrive. So what does Thrive does? Thrive is a program that can help people do physical therapy at home. And so people receive a tablet with an app, people can still talk with a therapist to talk about the condition and what they feel, what type of pain. And this therapist designs the exercises that should be done by the patient. If it is for the back, the exercises are different if the pain is on the knee. It's easier to understand. And so um, the patient receive the exercises. He can do it wherever in the whatever schedule he wants. It can be at 9 a.m. It can be at midnight. No need for to combine the schedule with a physiotherapist. No need to go to the clinic. No need to drive at all. It can be do at home, of course. And this is really a breakthrough because with this tablet that people receive at home, the tablet has a camera with computer vision, so it can see the patient and can give feedback to patient and can say, for instance, put your shoulder back, put your knee down, adjust your posture. It can give real feedback so patients can perform the exercises in a right way, so they achieved better clinical outcomes and faster clinical outcomes because indeed the patients perform the exercises and they achieve the clinical outcomes they want. Years later, it was also launched other product that is related with female pelvic pain to treat conditions related with female pelvic, normally pelvic pain, after pregnancy or during pregnancy, menopause, conditions that feel uncomfortable for females and that exercises can improve a lot the wealth feeling. Then it was also launched other type of programs because the previous two was for really healthcare conditions. This one is just to get people more active, to help people get exercises. No need for physical conditions. It's just to motivate people to perform exercises in the right way, just to move. And it's really incredible to be part of this because we receive a lot of feedback from patients. And in fact, AI is not the secret here. The secret here is the exercise, and people feel so much better after doing the exercise that it's magical to receive their feedback. But well, the company has a lot of products, but one that I would like to highlight is, in fact, this one. We have a lot of videos telling about the importance of exercise because it is a really important topic, how uh, exercise can help health in very ways. You don't need to have a physical condition or some condition to perform an exercise and feel better. Everyone, it's science. Everyone normally feels better when after performing exercises. More recently, it was also launched this real-time feedback. So this is a AI agent that, besides correcting the posture or saying, please put your knee back or your knee low, this type of feedback, this agent AI can also hear the patient and they can have a conversation. This was very recent, and we are receiving a lot of good feedback from patients that uh, like this type of interaction with AI and can improve much faster receiving this type of feedback in real time. This year, it was also launched an interesting product that is for mental health because we receive a lot of testimonies from patients that said that after doing the program, they feel a lot of better in terms of anxiety or depression. And this was not something that we were looking for, but it was very interesting to see. And then we were we investigated what happened, and physical pain can be very limiting for persons. For instance, a walk to the park, and if someone has back pain and is afraid, or perhaps, oh, okay, I can go with my family to that park for a walk, but if I don't have somewhere to sit in the next 20 minutes, I will be in a lot of pain today. And if I feel a lot of pain in my back, maybe during the afternoon, maybe this night I will not sleep, and I feel I will not sleep. Tomorrow I will not be able to work properly. So a thing that is just so simple as going to the park, people tend to avoid them so can they can avoid pain and start to isolate, stay more at home, alone, and that can be a very difficult for mental health. So we saw that these exercises, this help, this AI help could improve also the mental health of patients. But so what, in fact, I do here, I do a lot of things. The first of all is the develop the to I work with a lot of data. As you can imagine, we receive a lot of data from patients. We work mostly with the US market, so millions of patients and millions of data. And metrics that we have to analyze. And we have to interpret the findings and prepare for scientific publication because our goal is also to advance the scientific community to give this information back to the scientific community. How can this type of AI agent can in fact help clinical outcomes? So we received this data, we analyzed through softwares, the data analysis, and we write the scientific reports for the community. I don't know if you are very familiar with the scientific publications, but just in a few words, we prepared everything. We prepared the manuscript with all the results, the data, why we did it, how we did it, and the results, the interpretations that we have from this. And since we want this to be public for the scientific community, we want these manuscripts to be published in scientific journals. So we send them to scientific journals, and they are peer reviewed, meaning that independent scientists all around the world that are chosen by the journals, we don't have influence on that, can evaluate the work that we did, can give feedback, can ask questions, why you did that this way, why did you apply that statistical test, why didn't you use more data or less data, uh, and then can say you are allowed to publish these results on this scientific journal. And just to give you an idea, in the past years, it was being published for 40 papers in scientific journals, which is a very incredible milestone for a Portuguese company. um, and so that is part of my work to public this information and on scientific journals, international journals, and also to work with other teams to create innovation in the way that the clinical team can help, for instance, informatic engineering. The informatics create the AI and create how algorithms will work, but they want feedback. For instance, for this last product, mine, they ask us, clinical team, what do you think? Do people care more about sleep, or they want to see the heart rate on the clock? Things like that, and we have to look for in the literature to give them real feedback supported by other studies. We also are responsible for the development of clinical trials. This is a clinical product, so everything has to be tested before going to in contact with patients. And we have several clinical trials ongoing, and we have to report to the authorities how many patients are enrolled in the clinical trials, how many drop out, people can give up on the clinical trials. Maybe they don't get along with technology and didn't feel comfortable and they want to drop out. We have to report that type of things to be always in conform with the rules of the external authorities. So what are the benefits and challenges? So this leads us to a faster diagnosis, of course, and a faster recovery, more personalized treatment, and also a lot of innovation, and it's much faster to innovate. But of course, we know that we have to be careful with data privacy. And one of the aspects that we are most careful about is the bias. As I told you, AI learns from examples, and it's very important to give different examples. We cannot feed this AI agent with the same type of patient, with the same age, in the same country. It's very important to have a diverse pool of patients and to feed these agents with the most diverse information that we have access. And we know also that not everyone get along with technology, so that is also a challenge. The future of AI, we see it with a bright future, more accurate in terms of monitoring, especially in devices like this that can be used at home and can lead to early detection of more conditions and essentially as a partner for professionals to achieve better results. I think is that the main key. No sci-fi scenario, but just a partner that can help healthcare professionals. And so I leave just some time for questions. But first, I would like just to put one on the table for you to think at home. Imagine how you use AI in healthcare if you are in charge. Thank you.